everyone. Welcome. Thank you for joining us. Real quick, to those of you who do not know me, my name is Michelle Schwartz, and I am the Program and Outreach Coordinator for the YWCA Princeton's Breast Cancer Resource Center. And my coworker, Betsy Bell, is on here as well. Hi, Betsy. And she is our Support Services Coordinator. And the Director, Melissa McMahon, is not on tonight, but the three of us make up the BCRC. We are thrilled to be bringing back our Eat Better, Live Better program as we partner with our friends at Eating for Your Health. And to kick off our series tonight, our first course, Nutrition After a Breast Cancer Diagnosis, Prevention Through Food. So we're so excited. I'm a survivor myself, so I'm very thrilled to hear, all the information that we're going to hear tonight. And I'm going to hand it over to Marian Renson, who is our friend over at Eating for Your Health.
Thank you, Michelle. We are really excited to be here. And I am Marian Renson, the Executive Director of Eating for Your Health by Suppers. And we help people to understand the relationship between what you eat and how you feel, encouraging people to eat in a healthier way, whatever that means to you. For some people, it may mean cooking all of their meals for the week. And for others, it may mean introducing a salad to their plate. So we do not judge wherever you are in your journey to healthier eating. We just are here to support you in a non-judgmental way, and encourage you to explore and experiment with what works for you, not what somebody told you to do, but what you've learned that works for you. So we have a lot to cover tonight. So I just want to get started introducing Dr. Benito, who is our Chief Medical Advisor. She's also our interim board chair, and she is absolutely incredible with the amount of information that she has and a practical approach to really to addressing your health. Dr. Benito is passionate about educating her patients and us and giving us practical tools to improve well-being. She's board certified in endocrinology, diabetes, and metabolism, attended medical school in Spain, and completed a residency in internal medicine at the Pennsylvania Hospital at the University of Pennsylvania, and completed a fellowship in endocrinology, diabetes, and metabolism at the University of Pennsylvania, completed a 2-year fellowship at the University of Arizona Center of Excellence in Integrative Medicine, where she is a guest faculty. And she's also studied herbal medicine at David Winston Center for Herbal Studies and is a certified meditation teacher. So she really does take that integrative approach while still practicing the traditional medicine, and also just interspersing a lot of other modalities to her practice. So I'm so pleased to have Dr. Benito here.
Thank you. That's very kind. Good evening and welcome, and thank you for being here. I'm going to start sharing my screen so you can see what we're going to be talking about tonight. So this is nutrition after a breast cancer diagnosis, and that's what I'm going to be talking about how you can support your body with nutrition. These are for women or men who've had a breast cancer diagnosis, how to prevent another breast cancer, recurrence of the breast cancer, but also for women who've never had breast cancer, but whose sisters, mothers, daughters have had breast cancer. And again, men can be affected as well, maybe not as much as women. Or if you're somebody who just wants to do the best you can to try to prevent that diagnosis. So why is food important? That's in particular plants. And that's because the more vegetables you eat, the lower the risk of breast cancer and the breast cancer coming back, what we call recurrence. Not only for breast cancer, but also other cancers. So diets that are rich in fruits and vegetables have been associated with a lower risk of cancer of the mouth, of the colon, of the rectum, lung, and again, breast. And that's because plants have this natural anti-inflammatory and anti-cancer compounds. They also have fiber. And fiber does many things. One of them is that it will bind cancer compounds and it will excrete them out of the body. It also improves our gut immune function. And that immune function is what helps you defend or kill those breast cancer cells. It also decreases estradiol, the main estrogen in the body. when you hear that, you think, well, maybe fiber is only good for women who've had estrogen receptor positive cancers, and that's not true. Fiber actually is good for any kind of breast cancer. Vegetables in general will lower growth factor levels. And when you have high growth factor levels, that is associated with higher breast cancer risk. So again, growth factors make things grow, including breast cancer cells. So the more vegetables is what you want, because you would lower those growth factors. Things you don't want to have in your diet, at least not a lot of, are added sugars, whether in desserts or sweetened beverages. Added sugars are going to increase the risk of breast cancer because they trigger insulin and growth hormone. Insulin and growth hormone are growth factors that are going to make cancer cells grow. So you want to limit added sugars in your diet. Pesticides might have a role in breast cancer. Now, the data here is not that robust, but there's some data that makes us a little bit concerned about those pesticides. So we're going to talk about how can you be safe around food. And so the Environmental Working Group has a really nice list that they publish every year of what they call the Dirty Dozen and the Clean 15, and we'll go over the one for this year. In addition to added sugars, when you have a high amount of plain carbohydrates, that also increases breast cancer risk. What are plain carbohydrates? Those are carbohydrates that get broken very quickly in the gut, so they make your sugars go up faster, and you have these spikes of sugars. And when you have a spike, that's going to trigger insulin and growth factors. So I'm talking about white rice, white pasta, white bread, white flour. Whereas anything that has fiber is going to lower that risk. So when possible, you want to use whole wheat or whole grains, really, perhaps even before they become a flour, to help you decrease that risk. So what's the data on breast cancer prevention with vegetables? There are many studies. I picked one because I think it's a middle of the road. In one study, women who had 25 or more servings of vegetables every week, 25 per week, had a lower 37% lower risk of breast cancer when you compare those women with those who only ate 9 or less servings of vegetables per week. So that comes to a bit more than 3 servings per day. Now, if you think of guidelines, the CDC and other organizations in the US recommend that men and women, adults, have at least 5 servings per day. Some cancer groups advocate for up to 10 servings of colorful fruits and vegetables per day. What's a serving anyway, right? What are we talking about? If you have half a cup of green or orange vegetables, so half a cup of your broccoli or your green beans, that's a serving. Half a cup of fruit, so half a cup of apple or blueberries, quarter cup of dried fruit, that's a serving. 1 cup of raw green leafy or salad vegetables, and that's because they're more bulky, right? So that's 1 serving. And then also half a cup of cooked beans, peas, or lentils that are included as your vegetables, when they're legumes really, but they're included. So not difficult to do. So we're talking about plants, and we're talking about vegetables, and we're talking about fruits. But what particular fruits and vegetables do you include? Doesn't make a difference, right? So there are some that have been looked in particular for their effect on breast cancer prevention. And of those are plants that have anti-inflammatory compounds. So eating from the rainbow comes because plants have polyphenols and carotenoids, and these are plant pigments. Both of them are plant pigments, different, but plant pigments. So when you eat something that has a vibrant color, it's going to have either polyphenols and carotenoids in a larger amount, and that's what you want. Herbs and spices are also anti-inflammatory foods. And in particular, we're going to talk about saffron because it has a bit of data and studies for breast cancer. And there are some things about it that I think will be beneficial for breast cancer survivors. Cruciferous vegetables are a group of vegetables that have data in breast cancer prevention, and we're going to talk about them. Fiber has data for breast cancer prevention. Now, cruciferous vegetables can have fiber and can have some of these polyphenols. So these don't exist in isolation. They're all intermingled together. You can have foods that have a bit of polyphenols, a bit of carotenoids. They're cruciferous and they have some fiber. Some will be cruciferous and they'll have fiber. Some will be have fiber and carotenoids. there's always a combination. Nothing comes in isolation in the plant kingdom, which is so beautiful about, vegetables in general and fruits. We're going to talk about omega-3 fatty acids, and we're going to talk a bit more about the marine source and the vegetable source, but I'll talk about both. And then there are some studies where these particular groups of foods have been also shown to prevent breast cancer. So foods or vegetables from the allium family, those are your garlic and onions and shallots, which are rich in flavonols as a type of polyphenol, fresh legumes, high amounts of citrus fruits, and also fruits from the rose family. And you see those here: apple, pear, peach, apricot, plum, cherry, blackberry, strawberry, and raspberry. A lot to choose from. All of those have benefits or data for benefits in breast cancer prevention. So we're going to talk first about polyphenols. So again, we're going to talk about polyphenols, carotenoids, saffron, cruciferous, fiber, omega-3s. That's going to be what we're going to be talking. So each one of them, we're going to be talking about them. So polyphenols are a large family of plant-derived compounds, and they have many different chemical structures. Just have to think of plant pigments. If a fruit has a color, if a vegetable has a color, it has polyphenols. It probably has carotenoids, which is the other kind of plant pigment. So polyphenols, we think of them as natural anti-inflammatories. There's a huge classification. The general one is flavonoids and non-flavonoids, and within that, many different ones. We're going to focus on two, flavones and flavonols, and then we're going to talk about pomegranate, which has actually a combination of flavanol and flavone. So just to give you a sense, this is the whole group of polyphenols. And on those, we have flavonoids, and then the other three here, phenolics, stilbenes, and lignas, are non-flavonoid polyphenols. Within the flavonoid polyphenols, we have flavonols and flavones, the two we're going to talk about mostly tonight. Isoflavones, soybeans, we'll talk a little bit about them. Flavanones, anthocyanins, and flavanols. And again, fruits and vegetables don't just have one of them. So think of berries, they have anthocyanins, but they also have flavonols, right? They are combined, and that's just incredible. That's how they're such powerful foods. So we're going to focus now on these flavonol-rich foods. Again, it's a type of polyphenol, a type of plant pigment, just called flavanol. And flavonol-rich foods have been shown to decrease the risk of breast cancer in several studies. So when I find that something helps in one study, I'm curious. But when it happens in several studies, I really pay attention. And these are your flavonol-rich foods. So you find them in onion and leeks and other alliums. These are all the alliums that have been looked at for how much flavanol they have in them. So whether it's red onion or yellow or white, whether it's shallot, Italian or French, leeks, garlic, this Ramson Bears garlic I had never heard of. There you go. And it actually has a lot of flavanol in it. Ramps, Chinese chives, but even your Welsh onions, which I use in salads very often, have a lot of flavanols in them, which is really lovely. In addition to alliums, you have flavanols in kale, rosemary, broccoli, cherry tomatoes, blueberry, beans, apricot, and tea. In addition to being good to prevent breast cancer, they also have anti-obesity, so they lower the risk of obesity, they lower the risk of diabetes, anti-diabetic. They protect your heart, they're cardioprotective, and they protect your nervous system. So a lot of benefits from this group of pigments in the plant kingdom. Flavone-rich foods are a type of polyphenols, another type of polyphenols, another flavonoid. This decreased the risk of breast cancer in some studies. So the studies are not as many for flavones, but there are still studies. Flavone is very rich in, you find it very often or very high amounts in chamomile and parsley. You also find it in thyme. Most of your fragrant spices and herbs are going to have flavone components, rosemary, oregano, but also in celery, chili, bell peppers, apples, oranges, and watermelon. So look what I found. I went to the Supper's website, Eating for Your Health, and I found this breakfast and kale and bean soup. And this recipe is full of flavonol and flavones. So just go through it. It has garlic, a flavonol, onion, a flavonol, kale, flavonol, beans, flavonols, bay leaves, flavonol, oregano, a little bit of flavonols, but mostly what oregano has is flavones. So this is a recipe that is really rich in those flavonols that are so beneficial for us. Pomegranate. So pomegranate is a fruit, and pomegranate has it has become really interesting in studies in breast cancer and other cancers as well. The studies have been done not with the pomegranate itself, but with the seed oil, with the fermented juice, with pomegranate juice, as well as with the extract of the peel. So that's more of a supplement, really, not so much food, right? The data comes from laboratory studies. And that is, in those studies, pomegranate was able to block the growth of breast cancer cell. And that seems to be due to the content of polyphenols in the pomegranate, in particular 2 polyphenols, luteolin and ellagitannins. Ellagitannins are a type of polyphenol that belongs to the flavonol group, and they're also present in all these other foods or fruits. They are present in strawberries, blackberries, raspberries. They're also present in black tea, almonds, walnuts, pecans, and also rose hips. And ellagitannins, as you see here, they have data on breast cancer, but also many other cancers for prevention. Interesting, the effect of ellagitannins on breast cancer seem to be similar to medications we call aromatase inhibitors, probably not to the degree of a medication, but that's how they seem to work, in addition to other effects on prevention of breast cancer. Luteolin is another of the pomegranate polyphenols, another of those pigments. It's not flavone, and as we talked about before, flavones, you find them in some of your fragrant herbs and spices, and it's also in dandelion. We're going to move to another group of polyphenols, another group of pigments. So we talk about polyphenols, we're talking about now carotenoids. And carotenoids, again, are pigments, and they are the ones that give your vegetables the bright red, the bright yellow, and the orange color. And you'll see some foods that don't have a bright red, yellow, or orange, but they have carotenoids. And you're going to scratch your head, but they do have these pigments in them. Carotenoids are important because they lower the risk of cancer coming back. So they lower that chance of your tumor recurring. They also decrease the likelihood of dying. They work by blocking the production of breast cancer cells, and they also lower growth hormone, those growth factors. In this case, food is better than supplements. We're always looking, can we take a supplement? Can we make this? Can we take a bit more? Food is better than supplements. They, again, decrease the risk of breast cancer, and you can categorize it by alpha-carotene, beta-carotene, beta-cryptoxanthin, and lutein-zeaxanthin. They lower the risk, in particular, of estrogen receptor-negative breast cancer. Not lycopene. Alpha-carotene, beta-carotene, lycopene, they lower the risk of estrogen receptor-positive breast cancer. Carotenoids, interestingly, need to be consumed with fat to be absorbed, and they do fight cancer in the body. That's their benefit. So we're going to review the different carotenoids. So we'll start with alpha-carotene. And alpha-carotene produces vitamin E. All the foods that have alpha-carotene will give you vitamin E, but not as much as foods that have beta-carotene. And we'll talk about those next. In studies, when people had high levels of alpha-carotene, they were less likely to die of heart disease. And we know that especially in women, heart disease is very important. You find alpha-carotene in pumpkin, carrots, tomatoes, collard greens, tangerines, winter squash, and peas. And this is what I said before, collards and peas are not orange, right? But they have this alpha-carotene in them. They have that pigment in them. Beta-carotene is the one that converts into vitamin A a little bit more easily. It's an orange pigment, and you find it in cantaloupes, mangoes, papayas, carrots, sweet potatoes, spinach, kale, and pumpkin. And I know spinach and kale are not orange, but that pigment is in them as well. And it hinders the production of breast cancer cells. If you've ever had either yourself or your child eating a lot of carrots, you'll notice that their skin, especially the palm, will turn orange. And that's normal from carotene, but it's not dangerous. It's not harmful. Beta-carotene may also help us prevent sunburn. So eat your carrots. Lycopene is another carotenoid, and this one gives foods a bright red color. And that's what you find in watermelon, in tomatoes, guavas, grapefruit, papaya, carrots as well, asparagus, I know they're not red, red cabbage, red bell pepper, and parsley, same here. It is an antioxidant. Interestingly, when you have lycopene in tomatoes, you absorb it better if the tomatoes are cooked. So even if you just drop them at the end of cooking your soup, or you put them in, light stir fry, you'll get a bit more lycopene in those tomatoes. the women who had the higher levels of lycopene were also less likely to have hip fractures. And that's also important because that's another big one for women. I mentioned saffron as a spice that has interesting data in breast cancer research. Saffron comes from the crocus flower. Saffron is the stigma of the crocus flower. And saffron contains many different compounds, including something called crocin, beta-carotene, lycopene, we've talked about those two already, also zeaxanthin and flavonols, which we talked about before. It does have anti-cancer activity. But the really cool thing about saffron is that it also improves mood. And it's been shown in studies to help both anxiety and depression, not only in breast cancer, but also in women or men without breast cancer. There was one study that I found very interesting where saffron was actually studied along with chemotherapy. And it was beneficial in reducing fatigue and improving the white cell count in women who have a HER2 positive triple negative breast cancer, who again were getting chemotherapy. Very interesting study. The dose that has been shown to be beneficial is about 30 milligrams per day. And if you translate it into food, that'd be 13 stigma. So 13 of these little filaments. That may be a little hard to do in your diet. Of course, you can add saffron to your soups, or you can make it as a tea. But, even adding a bit of saffron, I think will be beneficial as part of your integrative, meal plan. We're going to switch gears one more time. We're going to talk about cruciferous vegetables. Cruciferous vegetables are plants that contain two main compounds. One is called sulforaphane, the other one indole-3-carbinol, and they both have anti-cancer effects, and they also help the body detoxify. They shift the body into a healthier estrogen balance. Almost like fiber, the data in cruciferous is good not only for breast cancer that is estrogen receptor positive, the cruciferous vegetable family is good for other types of breast cancer. Plants in that group are arugula, broccoli, Brussels sprouts, cauliflower, kale, cabbage, collard greens, horseradish, kohlrabi, mustard greens, radishes, rutabaga, turnips, turnip greens, and watercress. The goal is to get between 1 to 2 daily servings. And remember, if you think of a serving of broccoli, that'll be half a cup of broccoli. So 1 cup is 2 servings per day. Not that difficult to do, right? Fiber, another part of plants that helps us fight cancer. It lowers breast cancer risk, lowers inflammation, clears estrogen, improves gut function, immune function, a lot of different effects. The goal that has been thought to be good for breast cancer survivors or prevent breast cancer is 30 to 45 grams of fiber. And that said, that is a full-time job. The average consumption in the US is 15 grams per day. The recommendation for women without a high risk for breast cancer or a breast cancer diagnosis is 25 grams. So women in the US should get 25 grams. Men should get 30. If a woman is trying to lose weight, the goal is 30. And again, for breast cancer, we aim for 30 to 45 grams of fiber per day. Now, if you include fiber, whether it's legumes, nuts, seeds, berries, other fruits, including avocados, which are a fruit, vegetables and whole grains with every meal, that will give you your desired amount of fiber. Now, if you are like the average American and only consume 15, you cannot go from 15 to 45 in a day. That causes a lot of bloating and constipation. So you want to go up slowly on the amount of fiber you consume. When we talk about fiber, there are two kinds. There is soluble and insoluble fiber, and both seem to be beneficial. Insoluble fiber adds bulk, so that helps with constipation. And you find insoluble fiber in whole grains. Think of wheat bran, right? People take that for constipation many times in their food. The skin of root vegetables also has insoluble fiber, and so do beans, nuts, dark green leafy vegetables, zucchini, broccoli, and green beans. Soluble fiber, on the other hand, is called soluble because it dissolves in water. It slows down digestion and it keeps you full. And that's what this kind of fiber has been shown to help with lower cholesterol and weight. You find soluble fiber in oats, Brussels sprouts, fruits, legumes, and avocado. The truth is that most vegetables are going to have a combination of both kinds of fibers. They may have a little bit more than one than the other, but you probably find both in most plants. This is another list of your fermentable or soluble fiber and just how much fiber you have in each one of them to give you a bit of a guide if you're trying to get to those 30 or even 45 grams per day. So I found another recipe on the Sappers website, and this one has carotenoids, cruciferous, flavonols, flavones, ellagitannins, and fiber all in one recipe, and it looks pretty simple. So this one gives you kale, and 1 cup of kale is going to give you 7 grams of fiber. It's a cruciferous vegetable. It has flavonols, and it has beta-carotene. There's green apple. There are 2, and apple gives you fiber. There are cranberries that give you flavonols. Celery gives you flavones. Fennel bulb, it gives you fiber and a little bit of flavonols, not super strong in flavonols, but it has some. Pecans give you fiber and ellagitannins that we talked about with the pomegranate. And avocado gives you fiber and a little bit of polyphenols as well. So another amazing recipe that I'm going to be making very soon. I'm going to switch gears, and we're going to talk about omega-3 fatty acids and omega-6 fatty acids. And these are not plants in general. Some are. Some omega-3s come from plant. So here the importance is balance. So you want to have more of your omega-3 fatty acids in your diet and less of the omega-6 fatty acids. So what are we talking when we talk about omega-3 fatty acids is EPA and DHA, and this is the what they stand for. You find EPA and DHA in cold water fish. You also find DHA in your DHA-enriched eggs. ALA comes only from plants, and you find that in your flax, chia, hemp, and pumpkin seeds, as well as walnuts. Omega-6 fatty acids, these are the ones that we want to have less of. There are in meats, butter, egg yolks, whole milk, and your whole milk dairy products, so whole milk yogurt, whole milk cheeses. And that's because they have something called arachidonic acid. It's a type of omega-6 fatty acids. Your common vegetable oils, your corn oil, safflower, sunflower, cottonseed, and any processed food made with those oils is going to have linoleic acid, and that's another omega-6. Now, I'm not telling these are bad. I'm talking about the balance between these foods and these foods here. Palmitic acid is another kind of omega-6, and that has been linked to an increased risk of breast cancer. And you find that in palm oil. So look at your labels of the foods you buy. Palm kernel oil, butter, milk, cheese, and meat. We do know that a high intake of animal fat and meat increases the risk of breast cancer. So again, it's a balance between one and the other, right? So omega-3, you'll find them. Again, the DHA and EPA is going to be in your marine sources. So salmon, sardines, mackerel, trout, oysters, shrimp. Of all of them, salmon has the largest amount. And then you find ALA in mostly your plant-based foods. Interesting, people are always concerned about can they convert ALA to these other 2 omega-3 fatty acids. And the truth is that yes, you can convert ALA into DHA and EPA, and you do that best when your diet is low in omega-6. So there are many reasons why you want to have low omega-6 in your diet. Omega-3 fatty acids have been shown to decrease fatigue in breast cancer survivors, which is a big one. Whether a woman has gone through, surgery, chemotherapy, radiation therapy, all of those are going to cause fatigue and cause fatigue. So omega-3s will lower fatigue, will improve also pain because they lower inflammation. So in practice, you want to ensure omega-3s, ideally from food, at least 3 times a week, and preferably from marine sources. That's because that's where the data is mostly coming from studies on using omega-3s from fish, usually fatty fish. And you want to reduce your omega-6 intake. If you eat red meat, for instance, you don't want to do that every day. There's also some interesting research on fish oil, which has shown that fish oil may offset the negative effects of aromatase inhibitors on bone. So aromatase inhibitors are given to women with an estrogen receptor positive breast cancer, usually for 5 years, sometimes 10, to block any estrogen that could be coming into the body. And they actually, one of the side effects is that they can actually lower bone density. So fish oil might help prevent that negative effect. Fish oil also seems to protect women from getting neuropathy that comes from chemo if you take fish oil. So something really interesting about fish oil. And again, you want to aim to not have this high omega-6. Omega-6, again, are inflammatory. They're going to cause more fatigue and more inflammation in the body. Mushrooms. White button mushrooms have been associated with a lower risk of cancer. And it's not clear why, whether it's because they have fiber, because they have some effect on the immune system, or something else that we don't know yet. Most of the studies on mushrooms have been done in Asian countries. So until we know more, what I would recommend is that you use mushrooms as food, not as a supplement, and that you eat about a quarter cup of mushrooms per day, any kind of mushroom. That seems to be linked to a lower risk of cancer. And again, this is in general, not just for breast cancer, although most of the data is in breast cancer. It could be true for other cancers as well. So if you're interested in more than just food, you should talk to your practitioner. So what about soy and flax seeds? There's always questions about those, right? Soy and flax seeds have phytoestrogens, and phytoestrogens are plant estrogens. So that causes a lot of confusion and concern. If it's a phytoestrogen, wouldn't that be bad for me with breast cancer? So we have no data on soy as food, and I can tell you, that soy as food lowers the risk of breast cancer recurrence, so cancer coming back. It prolongs survival in breast cancer, and it helps prevent breast cancer. So soy as food is a yes. Soy as a supplement is not recommended. And that's because those are concentrated phytoestrogens, and there's no data on those. The data was from a study on women eating soy, not taking a supplement. Flax seeds, I'm going to tell you, the data is not where we are now with soy. So if you had asked me about soy 10 years ago, I would have told you what I'm going to tell you about flax, that maybe, but we don't know final data. So flax seeds contain both lignans, a type of polyphenols, and omega-3 fatty acids, that ALA that we talked about. In one study, given women 3.5 tablespoons of flax seeds in a muffin every day lowered breast cancer growth. These were women who had breast cancer, who were going for surgery, and about a month or so before surgery, were given a flaxseed muffin with these 3.5 tablespoons. And when they got to surgery, those who had the muffin, compared to the ones who didn't, had a smaller markers of growth for breast cancer, lower numbers of those markers. Higher levels of lignans in blood seem to be protective. They prolong survival. Flaxseed oil has no lignans, it's all omega-3 fatty acids. Now, there are other plant foods that also have lignans, and those include nuts, seeds, other seeds, whole grains, fruits, vegetables, including garlic, carrots, and asparagus, and even coffee. So because the data for flaxseed is still preliminary, and that's because the data comes from observational studies, so just looking at people, one control study, this one, it's still a good idea to ask your oncologist whether they recommend flaxseed for you and how much. My home take message from this is that if you eat a bit of flax seeds, if you add them to your oatmeal, half a teaspoon or so, it's almost the same as you were eating garlic or carrots or asparagus. Just a little bit is not going to harm you. But you might not be able to do this 3.5 tablespoons until we have more data that supports its use. So in moderation, okay. If you are not sure, always good to ask your oncologist what they recommend for you. So we've talked about all these different foods, and I just put them here now on table so that you can see for estrogen receptor positive, alpha carotene, beta carotene, and lycopene have good data. For an estrogen receptor negative, berries, peaches, nectarines, and then alpha, beta carotene, beta cryptosomething, lutein, zeaxanthin. The DASH diet, which I didn't talk about, the DASH diet has data for this type of breast cancer. Low carbohydrates also has data, and then lignans is questionable. It seems preliminary good data, but it's not completely clear, as we said before. For HER2 positive tumors, salad is the one that has been shown to be really beneficial, and a salad-like. So it was a study looking at raw veggies with olive oil that was beneficial for these kind of tumors. So we talk about what foods you eat, what should you avoid. And we talked a bit about this throughout the talk. Sugar, and I mean by that added sugar, red meat in high amounts. In general, we do prevent plant protein, plain carbohydrates, again, all your white pasta, white rice, white bread, processed foods, because they have higher omega-6 and they're more inflammatory. I want to talk a bit about toxins and pesticides. So there are toxins we call genotoxins, and those are the ones that come from cooking red meat at high temperatures, from frying red meat, grilling, and also from smoked meats. The studies have shown that if somebody has this kind of red meat or cooks red meat in this way, the effect is worse if at the same time the diet is very high in fat and there's a lot of caffeine consumption in the diet. On the other hand, even if you eat this kind of red meat and you cook it this way, you'll have some protection with DHA, remember your marine sources and your eggs, allium family foods, so the garlic and the onions, leeks and shallots, cruciferous, kale, broccoli, and soy products, because they have isoflavones. So there are things that can make it a little bit more temperate, if you wish. There are other compounds in the environment, which we consider environmental pollutants, like DDT. They're banned, but they're still persist in the environment, and those have been found to have estrogenic properties. There are others, such as phthalates and these PFOAs, which you find in dental sealants and the food container linings. So sometimes in the can linings, you'll find them. You know, we don't think of this sometimes, but alcohol is a toxin as well. Alcohol is not clear whether it's because it has a bit of an estrogenic effect, oxidative effect, so inflammatory effect is what this means, or has an effect, a negative effect on folate. But it is thought to be a toxin for breast cancer. In some studies, even 1.5 drinks per week increase the risk. The data is very mixed. I've seen studies where, 1 drink per week is good. In some studies, only 2 per day is bad. In some studies, it's very mixed. But I would say if you really want to be safe, this is the most that you will drink. You probably will keep to 1 drink per week. I was mentioning before the Environmental Working Group and how every year they publish their list of the Dirty Dozen and the Clean 15. And it's a list that allows you to safely choose low to no pesticides, fruits, and vegetables. So this is their website, ewgenvironmentalworkinggroup.org. This is the Dirty Dozen. And I would say almost every year, strawberries are top of the list. So if you can, any of these foods, you should aim to get them from your local farmer who doesn't put any pesticide, doesn't spray, or if you can't, eat them organic. They also publish this Clean 15 list, and those are the ones that have the lower amount of pesticides. So you do not have to worry so much about having to get them organic. Sweet corn has an asterisk because in parts of the country, sweet corn could have a GMO. So if you don't want to have any GMO, you need to buy it organic. I just want to mention botanicals and supplements, and this is not what the talk is about, but I just want to give you a bit of a guidance as to how you go about them. Some botanicals have been studied. Many others have a long time tradition of use, and herbalists have used them for millennia. Some botanicals and supplements could have estrogenic effects, and of those, red clover is an botanical as an herb, licorice, and resveratrol, which is a supplement. Now, resveratrol is or comes from the skin of the peanuts, the red skin of the peanuts, grapes, as well as wine. Now, you don't have to worry that if you have peanuts with the skin, with the red, little skin, or if you have grapes, that you're going to induce some estrogenic effect in your body. The amount of resveratrol in those foods is very small. You will have to pretty much, really be an elephant eating peanuts every day, lots and lots and lots to get enough resveratrol. You have to be aware of potential interactions with medications. So what this is a call for you not to discuss or to get advice from somebody in a health food store unless they really are aware of what medications you're taking and they have a license to review those with you. Be also aware of potential toxicities in supplements versus food. So one example is EGCG. That's a component of green tea. EGCG in high doses have been shown to have liver toxicity. It damages your liver. Green tea, it's really hard to get to such an amount that is going to give you any liver toxicity. So food is safe, supplements might or might not. Many large cancer centers in the country offer an integrative medicine consultation. I know that MSK in New York, Memorial Sloan Kettering, does offer one. Gary Deng is a family physician at MSK who has a long-standing integrative oncology practice, and he will go through what you can and cannot have. He's very big in mind-body medicine, which I think is phenomenal. But he will go in detail as to what you should and should not have in terms of supplements or food. MD Anderson also offers an integrative. But you can ask your oncologist if their center offers an integrative medicine physician whom you can consult. So for your daughters, or for those of us who've had a family member with breast cancer, how do we lower a breast cancer risk? So plant-based diet, especially protective for those with estrogen receptor negative and progesterone receptor negative breast cancer, but equally good for everybody. Carotenoids, those orange foods, and red and some green like parsley. Cruciferous vegetables, 1 to 2 servings per day. Even sauerkraut 3 times a week has some study that was beneficial. Flavonol-rich foods, the alliums, right? The onion and shallots, kale, leek, broccoli. Flavone-rich foods, so all your fragrant spices, celery, chili peppers, beans. In women, 1 teaspoon of flax seeds per day for 1 year decreased precancerous growths when these women were at risk. So these were women who were at risk for breast cancer who had already a precancerous growth, and they were given a teaspoon of flax seeds once a day for 1 year, and that decreases growths. So that's something you want to consider if you are a woman who doesn't have breast cancer but has a high risk and has precancerous growths. And with that, I will end. Thank you.
Thank you, Dr. Benito.
Welcome.
A lot of great information. And for people who are a little overwhelmed with how am I going to eat so many vegetables in my diet, we eating for your health, we look at just eating with a plant slant, right? So it's mostly plants with a side of protein. And when we also, a lot of our recipes that Dr. Benito was sharing incorporate so many different vegetables. So if you can make a big pot of something and then eat it throughout the week, it's not like you have to think about it all the time. But I also know that we have other people that we eat with, right? So we try and help people to create recipes that can be adapted to more vegetables for people who want more vegetables, and add those proteins or animal proteins for those people at your table who want that. So it is possible. But let's get to some questions. So if there's anything else that anybody wanted to comment on before we start with questions? But the plant slant, it's a gradual process too. So just starting to introduce the rainbow into your grocery cart is a start. So let's see. A supplement to recommend for saffron, 30 milligrams.
I don't recommend a supplement. I think that if you want to do a supplement, you probably want to talk to your physician. I recommend it as food, and I think as food is perfectly safe. A supplement, when you get a supplement of saffron, it's not just going to have saffron, it's going to have a concentrated crocin or a concentrated something, and that might not be what you want. I actually haven't looked at crocin in particular, which is the main ingredient in saffron, but botanicals will have a main ingredient or a main component, and that is the one that many times have interaction with medications. So that's the one thing that you really want to go through your physician with, is whether they can review that for you and tell you whether that will be safe for you. So no as a supplement, yes as a food.
Is spinach a cruciferous vegetable?
Not that I know of.
I know, I didn't think so either, but I wasn't sure.
It is,
these categories sometimes just throw me. I'm like,
I don't think it is. We can look it up, but I don't think it is.
Yeah, I don't think it is either. I don't think it. Yeah, we addressed the flaxseed question.
Yeah, I don't know that you can or not take it with an aromatase inhibitor. I would say that you probably could take like a small amount of flaxseed, like you would do garlic and carrots. Nobody's stopping you from eating garlic or carrots if you're taking an aromatase inhibitor. Same with your flaxseeds. If you were putting a little bit of flaxseed with your aromatase, I don't think it's a problem. I probably wouldn't do a muffin with 3.5 tablespoons of flaxseed unless you ask your doctor about it, right? Is what I wouldn't do.
Good source of trout. I don't know of any. I don't see often a lot of canned trout. That
Yeah, I don't either.
Source. Your opinion on collagen?
So collagen, I don't know that there's any data for breast cancer. There's definitely data in, women will use it in menopause or after menopause because it does help with skin. The data is good for that. There's also some data for joint pain or arthritis. There's not enough data for bone density, or even when it would make sense because our bones have collagen, not enough data there. I'm going to say that, you can get collagen from food. You can get your chicken broth and you can eat chicken and, all that will have collagen. I think what you're probably interested in supplements. And I'm going to say there is actually, and I don't remember now, but there's a consumer organization that actually has reviewed collagen. And maybe, I know that I wrote about this on a blog that Suppers has. And there I actually put information on collagen supplements that have been reviewed by this consumer organization. There are only 3 brands that have no heavy metals, only 3. So I'm going to say if you're taking one of those, take one of those ones. Many of the common ones that we actually find in the stores have arsenic. Not a lot, but if you eat collagen or you use collagen every day, it's going to add up. I don't want to put arsenic. So I actually was consuming one of those, and when I read the studies, I said, oh, let's switch. So, and you can find them in powders, you can find them in capsules. At least 2 of the 3 are in powders and capsules. The 3rd one is only in powder. So I don't know if Marian can find it, and we can put it on the chat. Yeah, and that will give you a guidance if you're choosing some collagen. But I don't see any negative on collagen in general. But
as with almost everything that you said, getting it through food is the preferable way.
Yeah.
Soy, is there such a thing as too much? And what is the recommended amount of soy milk and tofu?
So it depends on what you're looking for. I think as part of your, surviving breast cancer or protecting you from breast cancer, I would say moderation. I wouldn't want you to have soy milk for breakfast, tofu for dinner, and edamame for lunch. I think that's a lot of soy. And there are other things that you can include in your diet. So it's just getting variety of foods as well. So I would say 1 serving a day will be perfectly fine. And if you can, try to include foods that are soy, so meaning that are not processed. So what you mentioned, milk, soy milk, and tofu, I think they're minimally processed. I definitely don't encourage people to eat tofurkey or, soy burgers or, they probably are quite processed. So just watch that too, right? When talking about soy.
Okay. I thought cinnamon was good to regulate blood sugar, but recently heard it can cause cancer, specifically liver cancer.
I don't think it's cancer. There have been a couple of reports on cinnamon, the false cinnamon causing actually liver toxicity, liver damage, and it's not really clear why that is. If you look at the studies and that link the cinnamon to this liver toxicity, there were doses between, I think the minimum was like 6 grams of cinnamon at high as 36. If you think of what 6 grams of cinnamon is, it's about 8 teaspoons of cinnamon a day. That's a little hard to do, I think, in our diet in general. So again, if you want to include cinnamon as part of your diet, yes. If you want to do a supplement, I said talk to a physician as well so they can monitor you, right? They can monitor your liver. And again, I don't think it was cancer. Maybe I'm wrong, but I think it was liver toxicity, just not cancer. And it's still not clear. It's thought that perhaps some people are more sensitive than others to those effects of the coumarin and cinnamon. Some people, because of that, have advocated that you consume the true cinnamon and not the false cinnamon. But again, the data is not clear on that. Thank you for that, for the link, Marian. On the
sure.
That's good.
Okay, let's see. I had both ER negative and ER positive breast cancer at the same time. Do I follow the diets that you recommended for both?
Yeah.
And one have a negative effect on the other?
No, and that's, I think, what the beauty of a lot of the things that we talked about. Even when I mentioned particular components of plants that are good for one type of cancer or the other, many, like the alpha carotene and beta carotene, are good for both. Right? Fiber, cruciferous vegetables, they're good for both, not just because they clear estrogen from the body. They have other things, other benefits. So absolutely, you can definitely have any of those and all of those. So if you think of, the talk, if you only get to the first real slide, not the slide of the title, but the title, the talk about, the slide with the plants and what not to eat, that's what you want to do. Eat mostly plants, avoid your added sugars, don't have a lot of the processed foods or your plain carbohydrates, and consume some of those anti-inflammatory foods, whether there's omega-3s in, marine sources, or, the flax, not flax, walnuts, or, chia, or any other, alpha linoleic acid. That really is it. It's a plant-based diet. And then put things that have anti-inflammatory compounds. And, vegetables will give you that.
And what was I just thinking so when you look at processed foods, so every single time a food is processed, some nutritional value is processed out of it. So even when you have a smoothie that has a lot of fruit in it, the fruit, it still may have the fiber, but the sugar becomes much more available. So it kind of loses that value. So every time a food is processed, it kind of loses that nutritional value. So when we talk about, all the white flours that have been just bleached and processed so that there's really no nutritional value, you look at the a food label, your nutritional label, and it gives you calories, it gives you, some fats and some carbs and things like that. But if you look at the nutrients in it, there's really nothing there. So really just looking to include as many of those whole food ingredients as you can. And then also knowing that 4 grams of sugar is a teaspoon. So if you're eating something that has, like a yogurt that has 16 grams of sugar, you may not have intended to be eating those 4 teaspoons of sugar. So really understanding the way that sugar can get snuck into a lot of the foods that we eat. Okay, so let's see. We consume a lot of chemicals from food packaging. Is it best to get these out of our bodies by eating a lot of fiber and vegetables?
Yes, absolutely. Yep. And what I would say is that if you can, so if I buy, salmon or even chicken, if it has a skin, I'll come home and I take off the plastic and I'll put that into a container that has glass. And if you don't have a glass container, wrap it in your, paper, oven, what do you use for the oven, for the, that paper that you put? Just wrap it there and put it into, if you want, into a plastic container, so that the fat doesn't touch the plastic, right? So you don't want to pull the plastic, those phthalates. So fat is going to pull those phthalates from the plastic. If the fat doesn't touch the plastic, it's not going to pull them. So just take off the plastic and put it. There was one study where they actually had, it was a mother and son, and they did a study with them that they got home from the grocery store and they took out whatever they have in packets, in plastic packets, and they actually put it into either a paper bag or something that was in plastic. By the end of the week, the amount of chemicals that they had in their urine was much, much lower. So just taking them out of the plastic and putting them into whatever you want, paper, anything that you have at home. You don't have to buy, even glass containers. Just wrap them in paper. You'll be fine.
Okay. Are you familiar with brassica tea and has good stuff from broccoli? Do you think it's beneficial?
So brassica tea is an extract, right? They're taking the extract. One of the components of broccoli is taken, which is the glucorophane. I think it is the one that is in there. I forget now, but it's a component of broccoli. So again, you're talking about a supplement. So even if it's sold as a tea, it's an extract put in water. It's just an extract. It's not just food. So this is going to have again, you want to be cautious with what you're taking in your as your medications or other supplements. What I would say is also what my David Winston, my herbal teacher, said is like when you have a plant. I said it before with kale or any other, with broccoli, the same. It's a cruciferous, so you have those benefits. But it also has polyphenols, and it also has fiber, and it also has, if you get an extract, you're losing everything else. You only have one compound. And that compound could be very potent in doing one thing, but you don't have any of the others. So I think that's the beauty of plants. They have many different compounds in them. So to answer your question, you probably should ask your practitioner because it's a supplement that what you're getting, no food. But I think it's always better to have food if you can.
Okay, is basmati or jasmine rice considered white rice?
You actually can get basmati white and basmati brown. You can get both.
Okay.
So I know that when I buy basmati, I can buy basmati brown. When I buy basmati, I buy jasmine brown. I know one of them can be brown. I'm not sure actually, now I forget. I think it's basmati that I buy brown. I had to double check on that, but yes. So yeah, if you combine it brown, then you have more of the fiber in it. So yeah.
And even combining some, brown rice with a white rice, we
have a small amount.
We look for net nutritional harm reduction, right? Like that gradual addition of the foods that benefit and the subtraction of the foods.
Or you eat your vegetables before you eat your rice, right? And then
you throw in a lot of vegetables into your rice.
Right. All the polyphenols in the vegetables.
How do I eat healthier?
Right. The polyphenols don't let you absorb so much of the carbs in the rice. So it's, there are ways to go around that.
All right. So we have, it's 7:59. Somebody just has a question about how to wash strawberries to make them, if they're not organic. I guess you just soak them, right?
I don't know that you can really clear all this. So it's always good to wash them. In general, the recommendations by any Cancer Society and other groups is that eating vegetables supersedes whether they're organic or not. So you're always better off eating vegetables, even if they're not organic, because they have other components that are going to help you. But yeah, definitely wash them. Absolutely.
And maybe the environmental working group may have information on that as well. But we are out of time. So I'm going to, unfortunately, Mary, I didn't get to your question. And Bonnie, okay. So that's, so we're just to be, considerate of everybody's time. So Michelle.
Absolutely. So again, thank you so much for joining us. And thank you to Dr. Benito for all this amazing and extremely useful and amazing information. I know I truly learned so much, and I hope the same goes for, everyone everyone that was able to join us this evening. And thank you to Marian and Suppers for providing this opportunity for this amazing program. It, I know, is greatly appreciated. If you want more information about anything this evening, please reach out to Marian or myself. I can put our information in the chat. I also have your email addresses, so we can, and my email address was on the registration form, so you can reach out to us that way. If you are a breast cancer survivor or you know of anyone who is, that could benefit from the services that the YWCA Princeton's Breast Cancer Resource Center provides, please also feel free to reach out to me, and we can give you more information about us. So we have more programs coming up with Suppers, the next coming months. So we'll be sure to send out the information regarding those programs. So we hope to see you all, back here again. Thank you.
Thank you.
Thank you.
On that note, I will say goodbye and have a great night. And thank you so much.